Good morning. Tim Bennett here from the Cortland Voice. I'm here with Dr. Timothy Bael from Cayuga Health. Dr. Bael, how are you today?
I'm good. Thank you. It's good to be here.
Everyone in the community has been talking about the new oncology center, the new cancer center in the Cortland community. If you could, tell us about that.
Well, we're excited about it as well. So, we have been providing oncology services in the Cortland area in some form for probably 3 or 4 years right now. But it's just this year that we've been able to develop and put in place a true oncology center that provides all the services for our patients with cancer. And then we see patients with cancer, we see patients with different blood issues and other things as well. So, there's all sorts of reasons people come to see us. So the center is both physician offices, and we have a physician there. Right now, it's 4 days a week, but it's probably going to go to 5 days a week. And there's also what we call an infusion center where people can have cancer treatments. And we're adjacent to the commons where we have laboratory services and radiology. So really, it's a complete suite of patient care that we can offer there. And it's just wonderful.
Okay. And I'll make sure that for all those watching, I'll make sure that we put the address in the comments and at the end of the video so that make sure that they're able to come
Great.
see you, Dr. Bale.
That would be great.
Tell us about yourself.
So I was introduced to upstate New York when I went to college. I went to Cornell.
Okay.
And I fell in love with the area. I lived here for 2 years after graduating. I worked in different places around the community. I worked at the Tompkins County Hospital back then as an orderly.
Mm-hmm.
And upstate New York was really home for me. So I left to go to medical school. I was in medical school in Pittsburgh, and then I trained in New York City, and then North Carolina before, down in Durham, North Carolina, before coming up here. But I met my wife first year in medical school, and I said, if there's ever a job in the Southern Tier, I'm going to take it. So I boxed her in.
Very nice.
And I was so excited to have a chance to come back up to the Southern Tier.
That's great. Let me ask you this. I know you spoke of some of the services that are offered at that site. Were there any other services that might be offered there as well?
Yeah, we try and make sure that patients with cancer, it's important to be near home. And we want to be a part of the community, and we want to keep patients from Cortland in Cortland. And our goal is really to provide as much of their care locally as possible. So it's office visits, it's follow-up, it's being able to see the nurse if they need treatments for cancers. That could be chemotherapy or immune therapy or other supports that can be done. They need CT scans, ultrasounds, other things to monitor how they're doing. We can do that there. And then we have other specialists in the area too, and we really try and make sure that we're just keeping people at home. There's just a wonderful suite of providers at Cortland all the way around. So it's a great place to practice, and I really hope that we can help people in the city.
Now let me ask you this. Obviously, everyone has, the word of the year or the phrase of the year the word of the year, I would say, COVID.
Yeah.
COVID-19.
No
What does your office do to keep everyone safe? A lot of people were unable to get, elective surgeries and different kinds of surgeries were not able to take place in 2020. What does your office do so that people feel safe to come see you?
So it's been core to our mission throughout the health system and clearly in Cortland. I worry as much about people delaying care or missing care as I do about taking risks from receiving their care. And particularly when we're dealing with things like cancer, time is important, and people can't wait for the end of a pandemic to be evaluated for or treat a disease that could be life-threatening itself. So we've taken multiple extraordinary measures to make sure that it's an absolutely safe environment. So one is that we are very specific about limiting flow of people into and out of the office. So that is an important safety measure. It can be a little frustrating at times because, I can't tell you how many times I've had a patient in the room and been Zooming with their son or daughter or spouse to make sure the entire family is involved in the care and the decision making. But sometimes it's hard to get everybody physically in the room. And sometimes we do need family members physically in the room. And that's something that, thankfully, as COVID has actually gotten a little bit better recently, has been more possible. We really take distancing to heart. Everybody, from the moment they walk into the door to the moment they leave, is in a personal space, whether it be waiting for a visit or within the exam room. So, there's very little risk or very little opportunity to have an interaction with someone that would put people at risk. And then we are absolutely take to heart all of the safety precautions that CDC recommends and beyond in terms of mask wearing, cleanliness, not only just distancing and hand washing. We really are incredibly diligent about that. And every time a patient's in a room and they leave the room gets a deep cleaning between every single patient. So it's really like a 10-minute process for a patient to leave room, patient to come back, because we want to make sure every single surface that you could think of is sterilized. And we have Denise is our nurse in Cortland, and she's spectacular. And she is one of the most thorough, thoughtful, meticulous people I know. So I feel really comfortable being in the office in terms of COVID.
I see. Let me ask you this. Do you have any forms of telehealth or things like that? Does your office offer
Absolutely.
that as well?
Yes, we do an amazing amount of things through telehealth. So, and when I see patients, I'll have patients who are coming in physically and I'll have patients on Zoom, and they're on our schedule just the same. And a virtual visit is the same as an in-person visit. We can do everything we would normally do, bar an exam, and sometimes that's critical and sometimes it's okay. But all arrangements, all advances in care, everything can be done virtually as well as in person. And we have a lot of patients who choose that as a means of receiving their care. And it's working really well. I think everybody's been surprised at how well virtual medicine and telehealth has been able to be implemented.
If someone has been diagnosed with cancer and they're in the Cortland community, why should they come see you? Like, what is the one thing that you and your staff and Denise, what will your staff do that will separate you from the rest?
So one is, listen, there's great providers in Cortland through us and through Guthrie Cortland. And so, we want people to be comfortable. What I tell patients is it's about them. So everyone needs to go the place where they feel most comfortable and where they feel confident, because it's hard to predict what happens with cancer and it's hard to know what the future is for all of us. But what's important is that you have a confidence in your team and confidence in your providers. And options are always good for people. My belief is that every patient should be treated for cancer with the best treatment that is available, period. And if I can provide that treatment near their home, we do that. But if there is a service that we cannot provide as well, or things that are done better at another center, whether it be SUNY or Roswell Park, who are our partners, or Sloan Kettering or Dana-Farber in Boston or anywhere else, we find that service for them. So I think what's important is that everybody needs to have their cancer treated or their illness treated as best as treatment is available. And we try our best to do that, but I only treat a patient if I know that I can do it as well as anybody, anywhere. And really, oncology is a team effort. Nobody operates alone. And the community practice and community hospital is a key part of people's care, but it's a part of people's care. And we rely on our broader network of providers and the options that exist throughout the region as well when those things are needed. So I think, we try and treat people like we'd want to be treated, like you treat a family member. And we do our best. But we want people in Cortland. It's important for people who live in every community to just have options of where they want to go. But there's good people. So no one, I think we're a wonderful place to come. We welcome patients. We hope that people want to come see us, but people should know that they're going to get good care everywhere, and they should feel comfortable with that. It's really a personal choice.
Gotcha. Final thoughts. Is there any other additional things that you would like to say to the community?
Yeah, well, thank you, first of all. We really enjoy being in Cortland. I love this community. It's been a pleasure. I just have the most wonderful patients in Cortland, so I'm really appreciative. I'm always appreciative of what I get to do and the trust that people put in us. And coming to Cortland for me has really been, it's just one of my favorite parts of the week, and I'm grateful to have it. So I would say thank you for the community, for their openness and support for us. And we're going to try and earn that trust and repay you with giving the best cancer care that we possibly can.
Dr. Bael, thank you very much. And to
Thank
the
you.
community, thank you for choosing the Cortland Voice.
Thank you.